Rose George, 9 Pints, A Journey Through the Money, Medicine, and Mysteries of Blood. Embark on a captivating journey through the world of blood in 9 Pints, A Journey Through the Money, Medicine, and Mysteries of Blood by Rose George. Discover the multifaceted functions of blood, its crucial importance in our well-being, and its intersection with medicine, culture, and society. Unravel the mysteries surrounding blood types, the role of leeches, the history and development of blood transfusions, and the various uses and challenges of plasma. The summary also delves into societal issues involving menstruation, HIV and AIDS, and the implications of trauma on our blood. Gain valuable insights into the world of blood and the life-saving potential it embodies.
The marvels of blood. The human blood is a marvel with many functions that keep our bodies alive. It is carried by the heart and lungs and performs everyday functions such as delivering oxygen, disposing of waste and blood clotting. White blood cells fight foreign bodies, while blood transfusion helps in saving lives. Blood also has different types, which need to be considered in transfusions to avoid hemolytic shock and prevent death. Our bodies are made up of many organs, and we tend to overlook the importance of blood in our everyday lives. Both the lungs and the heart work to serve blood in carrying out their functions. The lungs introduce oxygen into the blood, while the heart moves blood throughout the body. The blood is an everyday tool with many functions. For instance, our blood has 30 trillion red blood cells that deliver oxygen to the body's organs and tissues while conducting waste disposal by taking the used oxygen back to the lungs for removal. These cells travel a remarkable 12,000 miles in a day, showing just how crucial blood is to our existence. Blood also has other cells, like the platelets that clot the blood to stop bleeding when we injure ourselves. This process involves millions of platelets and proteins, and it's incredible how the leading actors work together to safeguard our bodies. Similarly, white blood cells do the dirty job of fighting against harmful foreign bodies such as bacteria or viruses. In medicine, blood transfusions are an essential process. Transplant patients, for instance, require red blood cells to accept new organs, and cancer patients with a deficit of platelets are infused with more. Shockingly, someone needs a transfusion of an entirely different blood every 3 seconds globally. However, it's not a one-size-fits-all kind of procedure, and blood has to be carefully considered before being transfused since it has different types according to antigens. The body will only accept the correct type of blood, and in worst-case scenarios, a patient can go into hemolytic shock and die if the blood type is wrong. Finally, leeches are known to welcome any blood type. However, with the current technology and sophisticated processes, one can get the right blood type for transfusion, which highlights the importance of careful consideration before any transfusion. In conclusion, the blood is an essential part of our body that keeps us alive and performing our daily activities, and we should pay more attention to it. The medical marvel of leeches. Despite being viewed as slimy parasites, leeches have been used for centuries in medicine due to their ability to remove excess blood and their powerful anticoagulants. Leeches may be reviled by many humans, but these wiggly creatures have graced medical practice and played an important role in human history. Before modern medicine, people believed that illnesses stemmed from too much blood in the body. As a result, leeching, using leeches to drain excess blood, was a common practice in many cultures. This practice persisted through the centuries and was used in ancient Egypt and Greece. Even the Hindu god of medicine, Dhanvantari, was commonly depicted with a jar of leeches. During the 19th century, leeches were in high demand among medical professionals as they believed that withdrawing blood from patients could prevent or cure diseases. This led to leech mania, which drove leeches to the brink of extinction in England. However, this practice was eventually dismissed as ineffective and outdated. Today, leeches have found a new purpose in the medical field. When a leech attaches itself to a host, it secretes a complex set of chemicals that thin the blood and prevent clots. These anticoagulants are made of proteins and peptides and have proven to be highly effective in allowing blood to flow freely to wounds. Even in the midst of technological advancements, leeches remain an important tool in modern medicine. In fact, leeches anticoagulants are still more effective than any compound engineered by pharmaceutical companies, making them a valuable resource for plastic surgeons who use them for postoperative treatment. Despite their creepy reputation, leeches have proven to be medically remarkable and continue to be an integral part of medical procedures today. Medical pioneer, Dame Janet Vaughan. Dame Janet Vaughan was a pioneering woman in British medical care. Her passion for the research of blood led to groundbreaking discoveries and the establishment of the emergency blood transfusion service during World War II, which saved countless lives. Born in 1899, Vaughan was a trailblazer, fighting for an education when educated women were frowned upon. She studied medical sciences at the University of Oxford and became an expert on blood diseases. Vaughan's most significant contribution to medicine was establishing the emergency blood transfusion service when World War II was looming. Vaughan set up the EBTS, which had 4 depots outside London that took blood from donors and delivered it to city hospitals in milk bottles and converted ice cream trucks capable of refrigeration. During wartime, the EBTS saved countless lives, and it served the peacetime population after World War II. Vaughan's work was important because war instilled the value of collective sacrifice in the British population, and her idea of blood donations persists even today. Although Vaughan faced significant challenges, including being the only female student at Harvard University during her time, she conducted pioneering research on vitamin B12 deficiencies in blood, and she published The Anemias, a groundbreaking textbook in the field of hematology. She was a true medical pioneer who made significant contributions to British medical care. The cost of plasma. Plasma, accounting for over 50% of blood volume, plays a crucial role in medical treatments. Source plasma, extracted through apheresis machines, is used to create important components like immunoglobulins and albumin. However, separating factor VIII from source plasma is challenging, leading to the payment of plasma donors. The U.S. leads the world in plasma exports, but plasma donors are often from vulnerable areas and may experience health risks. The plasma industry remains a dilemma without an easy solution. Menstruation taboos. Unfortunately, menstruation is a topic that still elicits embarrassment and silence in a lot of cultures, including the UK and Nepal. In Nepal, the practice of chowpatty is prevalent, where menstruating women are treated as pariahs, forced to sleep in tiny, dirty outhouses because they're believed to be polluting. Chowpatty still affects up to 58% of Nepalese women in the country's far west regions. The book also explores one curious theory as to why humans menstruate and posits that it may be an adaptation for flushing out substandard fertilized eggs. Understanding HIV and AIDS. HIV is a virus that invades CD4 white blood cells, leading to the depletion of the body's immune system, and AIDS. Sharing needles and unprotected sex are the most common ways of getting infected. With the help of antiretroviral therapy, ART, we can now successfully treat the virus. Prevention is still the best way to fight against the disease. HIV is a virus that attacks and invades the body's immune system through CD4 white blood cells. The virus penetrates the CD4 cells and fuses its genetic material with the DNA of the CD4 cell, allowing it to replicate and infect other healthy cells. The virus continues to deplete the body's store of CD4 cells until the patient develops AIDS. The virus can be easily transmitted through sharing needles and having unprotected sex. Even if the immune system identifies and eliminates the virus, one infected CD4 cell is enough to cause an infection. When a person is infected, the virus releases billions of HIV particles into the blood in the first 2 weeks, and then the body starts producing antibodies to fight it. After a few years, AIDS develops, and the body's immune system weakens, exposing the patient to several serious illnesses. Thankfully, antiretroviral therapy, ART, has made treating the virus successful. Art is made up of different drugs with various functions like preventing infected cells from reproducing the HIV virus and stopping the virus from penetrating healthy cells. With art, a person with HIV can live a normal life, and the disease is no longer infectious. Prevention is still the most effective way to fight the disease. People must understand the importance of safe sex and proper needle hygiene. With proper education and awareness, we can overcome the disease and eradicate it altogether. Treating trauma patients, a look at blood clotting and transfusion techniques. Trauma is responsible for 10% of deaths globally, and 40% of these deaths result from severe bleeding. When bleeding occurs, the body suspends the ability to clot in an attempt to prevent clots in organs and arteries. As a result, bleeding from wounds can lead to death. Reduced blood flow means less heat transfer, which can adversely affect clotting platelets, and can also lead to increased acidity and potassium levels. However, medical science has witnessed extraordinary advances in the treatment of trauma patients over the last decade. A key technique has been the readoption of fresh, whole blood transfusion, which has proven to be more effective than component therapy. While research is still ongoing, the use of fresh whole blood to treat trauma patients is an exciting development in medical science.
The summary of 9 Pints introduces readers to the fascinating universe of blood and its myriad functions within the human body. It showcases how blood influences various aspects of our lives, from medical practices such as transfusion and plasma harvesting to the life-saving advances made in trauma treatment and the HIV/AIDS crisis. Furthermore, it addresses societal attitudes towards menstruation and the ongoing challenges facing women. As an essential component of human existence, blood continues to hold secrets waiting to be uncovered, offering countless opportunities for advancements in medicine and society alike.